and welcome to WRPB and WRPB Studios. Okay, so I learn something new every day. And sometimes when I'm learning it, I don't even understand it. So what I do is I find people who are smarter than me, which is probably mostly everybody, and then I learn. So with me is Beth, Oreo, and you are a DPT?
Yes.
Which is?
Doctor of Physical Therapy.
Okay, so why'd you choose that field?
Well, I had finished my bachelor's and I wanted to do something else, and I looked at a couple of things. I looked at med school, nursing school, and PT school, and decided I wanted to go to PT school.
Okay, so how long you around the industry?
I've been a PT for 27 years, be 28 this spring, and I've been doing pelvic floor. A couple of years ago, I decided to change specialties. I've been an orthopedic physical therapist pretty much my whole career. And I, after all that time, got a little bored and decided I wanted to do something different, learn something new. So I went
Okay, so
back
I
and
will
did
tell you
some
now
training.
that everybody who's watching has no clue about what we're about to talk about.
For sure.
So let's start from scratch.
Mm-hmm.
All right, so what's it called?
Pelvic floor physical therapy.
Okay. Is it for men, for women, for both? Okay.
Mm-hmm. And children, although I personally don't treat children, but. Mm-hmm.
What is pelvic floor?
So the pelvic floor is, and here's the little model here, but it's basically a group of muscles, closes off the bottom of the body. So the pelvis here, the bony pelvis, wraps around, and then the muscles close off the bottom of the body, so they provide structure and support and stabilization to the spine, as well as support all the organs. And in particular, in women, the uterus, the bladder, and the lower gastrointestinal tract, so the rectum, the anus. And the pelvic floor supports those organs and controls and assists in the control of when it needs to open to allow us to go to the bathroom or, say, have a baby, and to close to keep everything in when we want everything to stay in. So when we're walking around, we don't want to be leaking urine and leaking feces. So the pelvic floor plays a really big role in keeping all that where it's supposed to be.
Okay, so now I know very little. So I'm going to guess the pelvic floor is the base that everything else would rest on.
Yes.
Okay,
Mm-hmm.
That's my ignorant
No, that's
thought.
a very good description.
But here is, since I'm older than dirt, okay, working on that area for women,
Mm-hmm.
would that help? If when women have children, they seem to have an issue if they cough or they laugh, leaking urine.
Mm-hmm.
Would that help that?
Yes. So that's oftentimes both a weakness problem. It's a coordination problem. The pelvic floor has to coordinate with the respiratory diaphragm. So if you're holding your breath or just not breathing well for a variety of reasons, if those systems, those two diaphragms, the pelvic floor is also called the pelvic diaphragm. So if those two systems are not coordinated and moving together, then that will cause leaking, even if the strength is normal. So childbirth is a big event for the pelvic floor. You've got something this big now coming out of something that is that big. Mm-hmm. And so that can really be disruptive. And a lot of women are told, oh, you've had a baby, so you leak. That's just normal. Or you're older, you're 75, so you leak urine, that's just normal. It's not normal. Common is not the same as normal.
Okay.
Nobody should leak urine or feces. Everything's supposed to stay inside until we're ready for it to come out.
So is it, I'm guessing it's almost two-facet here. It's a weakness and a coordination. Oh, or
Yes.
a coordination.
Mm-hmm. Yeah. It can also be a problem with too much tone. So a lot of people don't realize that. So if your pelvic floor is too tight, which can happen because of pain, when you have pain, you
tense
tend
up.
to guard, you tense up. So your pelvic floor can get very, very tense. And no muscle is supposed to be on and just squeezing all the time. So if you held your bicep like this all the time, it would just become exhausted and just give up. And if your pelvic floor gets exhausted and gives up, then you're going to leak. And but if it's exhausted and your bladder kind of gets out of sync with your pelvic floor, it can overfill and then it can just leak because it just overfills.
Okay. So first, one of the things I noticed for me is I'm one of the few people that don't have a back injury in Florida. But if I stress, so if I'm driving and the cop pulls up behind me with his lights, I get spasms in my back.
Right.
Because the muscles are tightening?
Right.
Okay. So my next question is, when it comes to the pelvic floor, is there ways to, and I don't know if I'm going to word it right, that's why I have you here, to retrain it or to work on it to strengthen it?
Yes.
I mean, is that what you do?
Yes.
Is you come up with a plan to strengthen it?
Yes. Yes. Or oftentimes it's more of a motor control issue. So a lot of times the muscles get what layman's term I use is that gets offline. So your muscles are supposed to have a certain amount of normal tone in them. And so if that tone is too high or too low, or they're not recruiting properly at the right time or in the right sequence, that's a motor control issue. So then it doesn't matter how strong they are, if they're not working when they're supposed to or in the right sequence with other muscles or other organs, then that's got to be realigned, and you have to learn to retrain your nervous system. So that's a motor control issue, and that's very complicated to teach somebody how to do.
So it's a topic that I'm sure most people haven't heard of.
Yes.
Is it fairly new?
It's not really new, but it's becoming more prevalent because it's not something. When I went to PT school, it wasn't taught at all. And even now, students that are coming out now, it's touched on in school. They get a basic education, but they are still, even coming out at the doctorate level, they're not qualified to work as a pelvic floor therapist coming out of school. It's still something that requires postgraduate education and specialization because there's just so much to it and it's just so involved. So that makes it a little bit more cumbersome. So it's a specialty, and it also requires one-on-one treatment with the patient. You can't be in a gym like you would if you were working on someone's knee. So that's been a barrier to developing and training a lot of therapists. And the training is expensive and long, and so that's also a barrier to getting a lot of therapists trained. But it's becoming much more popular. Providers, physicians, and other providers are becoming more educated about the benefits for their patients, so they're beginning to refer more for it. So it's beginning to rise and become more, more well known.
Okay, I'm going to take it out a little further. Does it help with sexual performance?
Yes. So your pelvic floor muscles are responsible for sexual activity and for orgasm. So if they're not working properly, then none of that's going to be working properly. And that goes for women and men. Mm-hmm. So, and that when those things are not working, people are pretty unhappy. And they'll put up with it for a certain amount of time, but when things really get bad, then they go to the doctor. But these are uncomfortable, awkward conversations
Very
to have
tough
with their doctor. So they generally don't go in and say, hey doc, I'm having all this pain every time I have an erection. Like, that's just not a conversation most patients are having.
I was a kid growing up.
Really bad.
I was embarrassed to go to the drugstore to buy a condom back then. So this has got to be even harder to do.
Yeah.
Okay?
Yeah.
But it's for men, ED is very prevalent now. Mm-hmm, mm-hmm. You hear about it all over, mm-hmm. whatever, which opens the door for conversation.
Mm-hmm. Yes.
Which now opens the door for people to come to you mm-hmm. and say, hey, there's nothing wrong with me that can't be fixed or worked on.
Right. or at least, attempted to work on, depending on, explore what's going on, what's happening, what can we do about it, how can we make your life better, because quality of life matters. And,
Right.
That kind of thing can really impact someone's relationship and in their family. And, when you have someone come in and they say, well, I haven't had sex with my spouse for 2 years because it's painful, that's a big deal. It's a big deal.
Now that we spoke about this, and I'm sure that on my Facebook feed, I'll have 8 million, because my phone is listening to our conversation, I'm sure. Is it, because it's something I haven't heard of and a lot of people haven't heard of, is it something that more and more people are starting to practice, or is it still very select people that are practicing it?
More therapists are going into it, especially younger therapists are going into it. But the pelvic floor and the whole pelvic region is so complicated. So you really need a strong orthopedic background and a strong clinical background before you become a pelvic floor therapist. So it's really not something that I would recommend a new grad specialize in. I think you need several years of general, training and education and clinical experience in general therapy before you specialize in it, because the pelvic floor is also I call it the steering wheel of the stabilization system. It's at the bottom of the spine. It's holding on to the coccyx and the sacrum, and so it's kind of steering. And so a lot of times chronic back pain and chronic hip pain, the problem, and person's going to therapy and they're not getting better, the problem is their pelvic floor.
Interesting.
And so that's why they're not getting better. And so if you don't have a good background in general orthopedics, you may not do well in pelvic floor.
Do you have more men or more women come to you?
More women. Women are more likely, from a statistical standpoint in the research, to seek out health care.
Of course.
Yeah, men have to be, one step from death before they... But when their penis is not working, they tend to be a little bit more motivated.
I'm a survivor of sexual abuse as a kid.
Okay.
And people say, oh my God, I'm so sorry. And I say, don't be sorry, it was a blessing. And they don't understand why I say that. And I say that because you're not going to stop it, ever. Mm-hmm. And I'm one of the few guys that will talk about it so I can help others. Mm-hmm. And since it happened, I might as well look at it as a blessing to help others. And you're right, men don't talk about it.
Right.
Those are things that men wouldn't talk about. Mm-hmm. Very hard, which I find interesting, because women are so much tighter knit together about getting things taken care of. Mm-hmm. I wouldn't want to be a woman because your plumbing is a nightmare. Mm-hmm. Okay,
it's a very complicated system.
Okay, on top of everything else. Mm-hmm. So I guess people have to learn that it's not embarrassing to say that you were sexually abused. It's not embarrassing to say that this is not working properly. What I like, the thought about what you do that's very interesting to me is that prior to going online or going to the doctor and then taking these pills or whatever and putting stuff in your body that doesn't really belong there, try this first before you go to those extremes of medication.
Right. I mean, basically what I do is teach people to heal themselves, how to work with their nervous system primarily, because the nervous system is what runs your whole body. So you're really working with, figuring out how to make your nervous system get control of your muscles again and make them either, kind of like, think of it as, a dial on a stereo. Sometimes that volume is turned up too much. Sometimes it's turned down too low. Sometimes things are just running amok and it's like chaos. Muscles are just doing their own thing and it's like anarchy.
Right.
And, just the nervous system needs to be in charge and everybody needs to be doing what they're supposed to be doing. And so just got to get everybody back online.
Okay, so someone comes to you. Approximately, how many sessions does one need to get online?
It's so hard to predict. I've had patients, a simple urinary stress incontinence that I saw 3 or 4 times and done. And then I've had other patients with really involved cases of interstitial cystitis and hypertonic pelvic floors that are really involved, and I've seen them for 6 months plus. So
Okay.
it's
We're getting a couple of time. How do people find you? You have a website? Mm-hmm. Which
Yep.
is?
BethOreoDPT.com.
And a phone number?
772-528-2348.
Okay, so I'm going out of line here and saying I believe that just pick up the phone and call Beth and give us some general information, and then she can kind of direct you in the right path to take. Most of the people, as you guys know, that I bring on are people that are here to help you. Beth makes money as an indirect benefit of helping others, okay? And that's her attitude. As you guys who know me know that I've been doing this 28 years, and the reason I do it is to help others, and indirectly I make my living. We're not a charity, we still need to eat too. But why go through life with issues that can be fixed? Okay, in my opinion.
Absolutely.
Okay. Check Beth out, everybody, and we'll be right back. Thank you so much for coming on.
Thank you. Thanks for having me.
We'll be right back.